welcome to Wholesome Health with Nostega. I hope you enjoyed my last video. Look at the digestive system, and in particular, let's talk about your stomach. Let's talk about your stomach. Do you know that your digestive system is comprises of a lot of organs? Part of it is the stomach. In your digestive system, you have the esophagus, or you can call it the food pipe. That's the place where your food passes. When you take in food, food goes into your through your mouth, and then the salivary gland secretes salivary enzymes that act on the food, and then your food goes all the way from your food pipe, which is your esophagus, and then it goes to your stomach. Now you say before it gets to the stomach, there is a sphincter that opens up, and then the food enters in, and then of course it closes back. That's the esophageal gastro sphincter. Now, when it enters the stomach acts on it. The stomach is a rich muscular organ that helps to act on the food you eat. The stomach acts on it, crunches it, and all that, and then digestion, takes place there. But you see, a lot of this, some of the digestion would actually take place in the upper part of your duodenum. Now, the duodenum is the organ that is linked to the stomach. Now, once it gets to the duodenum, right, a lot of absorption takes place. So the duodenum has two parts, the upper part and of course the lower part of the duodenum. The upper part, helps. That's where a lot of digestion really takes place. And then when it gets to the lower part of the duodenum absorbs the food, takes the nutrients and all that. Now, connecting to the duodenum is the large intestine, or we call it the colon. It's not as if it's actually longer, but it's in size. It's actually bigger in size compared to the small intestine. But the small intestine is actually a lot more longer, just that it's like folded. So when it gets to the large intestine, that's where the body then absorbs the water from it, and then all the way it travels to the rectum. So the large intestine is actually made up of different parts, you see. But I had to do this breakdown so that you can have an idea of what your gastrointestinal system looks like, what your digestive system looks like, just so you have that mental picture of, okay, this is how things work, you see. And being a nurse and reading about the anatomy of the digestive system, it's actually very complex, and it just reflects how powerful and how amazing God is, that He created us, in such a delicate way, in such a special way. And if we even want to talk about the anatomy of the heart, you see a lot of sciences, a lot of complexities, that happens to the heart. And I know we're not doing our mental health series, but just running again through the digestive system, I realized that God is beautiful. God is wonderful. God made us in His own image, in His own likeness. We are such a complex being. We are so delicate. We are so technical. It's so amazing how God just designed everything, because the duodenum, right, actually connects to the pancreas, and the pancreas, they secrete some enzymes that actually help with digestion, that help to regulate some of our hormones. And then just okay, I didn't tell you this part, that the stomach is just beneath the ribs, and just before the stomach, that's the anterior part of the stomach, that's where you have the liver. Now the liver actually has what we call the gallbladder, that also helps to secrete what we call bile. Now that also helps in digestion. So if we just look at the anatomy of the digestive system, we realize that God is such an amazing being, that created us in His, like I said, image and likeness. We are complex, and yeah, we are children of our Heavenly Father. So where am I going to? I am actually trying to, downsize today's teaching. I'm trying to narrow today's teaching to talk about gastritis, a physical condition that affects the stomach. Now, you see this part of you, right? Your stomach is not the only organ here. Your stomach is not the only organ in your abdominal cavity. Most times when we teach our children, we just say, "Oh, touch your stomach," and everybody's like, "Okay, everybody's coming here." That's your abdominal cavity. In your abdominal cavity, that's in your abdominal space, there are a lot of organs that are there. The stomach is one of the organs that are there. Do you get? The liver is there, the gallbladder is there, and the everything I just talked about now, that makes up the digestive system, they are all there. You see, the pancreas is there and all that. So there's a condition that usually affects the stomach, and that is gastritis. I find that this condition is affecting a lot of us, and we do not even know. Remember, I told you that I am your wholesome health coach, right? I'm not just going to teach you about how you should be healthy spiritually. I'm also here to teach you on how you can be healthy physically. A lot of condition that people are suffering from today is as a result of the food that they eat. It's as a result of the relationship they have between themselves and their stomach. God wants us to be healthy, and nothing should be missing, nothing should be broken. So please bring your chair closer. Let's talk about gastritis. What is gastritis? Gastritis is simply inflammation of the stomach. When the stomach is inflamed, when the stomach has some ulcers, when it has some sore, I think that's like the simplest definition I can give to it. It's simply inflammation. When you say something is inflamed, something is kind of like it's kind of sore. Let me use that word, like sore, like SORE. So it's just simply inflammation of the stomach lining, right? Not like the whole stomach, of course, like lining of the stomach. That's what's called gastritis. Now, this gastritis, what really causes it? There are a number of things that causes it, and one of the things that research and science has told us that causes it is a set of drugs called NSAIDs. All right. Now, these NSAIDs, they are non-steroidal anti-inflammatory drugs. What examples of drugs are in this category? Just like diclofenac, you know them. You take them every now and then for pain. Drugs like ibuprofen, they are actually very good. They help to reduce pain. But overuse of these drugs actually what causes the stomach to be inflamed. Remember that this stomach is very important though. If we don't have this stomach, how are we going to store food? Because the stomach is the organ that helps to smash the food we eat, crush the food we eat, store it, and of course starts the digestion process. Digest the food we eat, to break it into smaller substances that what can be absorbed by our body. So overuse of these drugs can cause this what is it? This gastritis. Another thing that can cause it is the use of alcohol. People who take a lot of alcohol, people who smoke, they can have gastritis. But I will not even forget to mention one organism that is actually like some of the causes of gastritis is what we call Helicobacter pylori. It's a type of bacteria that usually causes gastritis. All right. Now you can say it's infection. Yes, infection that usually affects the stomach. Helicobacter pylori is one of the causes of gastritis. Now, I will not even fail to mention stress. You see, stress can cause gastritis. You can tell me how is stress cause gastritis? Now, there's a hormone called cortisol hormones. It's like a stress hormone. A lot of time when we are stressed, the brain tends to release these hormones into the bloodstream. Oversecretion of these cortisol hormones can cause inflammation of the stomach lining. And what will happen? Gastritis has taken place. So you may want to ask, what are the signs and symptoms? How am I going to know that, I have gastritis? Number one sign is what we call abdominal pain. Some people have abdominal pain when they have gastritis. In fact, most people. And this pain, sometimes they'll tell you, is some people before they eat, some people after they eat, they have this pain. All right. Another sign and symptom is what we call dyspepsia, indigestion. Some people they usually say this, that I'm eating, but the food is not digesting. They feel like the food does. You feel like you want to vomit. You feel like you want to go to the toilet. It's just not settled. That feeling of indigestion, that feeling of discomfort. It's just not settling in. That's dyspepsia. Some people also experience bloating of the stomach. It's another sign of symptom. Some people experience nausea. They feel like they want to vomit. And the abdominal pain I mentioned, like usually epigastric pain. You have your belly button, just above your belly button, because the stomach is just beneath the ribs, you see. So just above the belly button, that's where people really have that, pain. So okay, I talked about nausea. Now, in severe cases, gastritis can actually cause anemia. How does it cause anemia? When I was talking about, because one of the signs and symptoms of this gastritis is that some people, they experience what is called melena. When you go to the toilet, their poo is kind of like reddish in color, but the reddish is like dark red. You know what I mean? Like it's like dark red in their poo, in their feces. That's melena. Then there's something called hematochezia. That one is like bright red blood in their poo. Okay? And in severe cases, people experience hematemesis. That means in their vomitors, there's blood, there's stains of blood. Now, what does that tell you? That the inflammation taking place in the stomach lining is already causing bleeding. And this bleeding can lead to anemia. So you see the person is experiencing signs and symptoms of anemia, meaning there's shortage of blood flow in the in the body, and that's because the person is already bleeding somewhere. Right? Although that's in severe cases. Okay. Now, I don't really like amplifying. Let me amplify the symptoms. Let's talk about how can you really get this treated. Now, let me make a disclaimer. I'm not a doctor. I would encourage you, if you're experiencing any of these signs and symptoms, please do well to visit your doctor. Okay, they are licensed to give the treatment and all that. But the use of medications like omeprazole, Gascol, they are under what we call PPI. They kind of prevent the stomach from getting inflamed. They kind of create a coating to the lining of the stomach, if you know what I mean. Like they just help to soothe the the inflammation. But beyond that, if you listen to the causes of gastritis, you'll be able to know how to treat it better. For example, I mentioned stress, that some people, their gastritis is caused by stress. So imagine you knowing that, oh, what's causing this gastritis is stress. So looking out for yourself, making sure that you're able to manage your stress can go a long way to solve the problem for you. Aside that, just going for the basic treatment. If someone's gastritis is caused by Helicobacter pylori, the person needs to go into the triple therapy treatment, which should entail the antibiotics and of course the PPI. So of course, again, you now need to visit your doctor because they are licensed to prescribe medications for you if you're experiencing those signs and symptoms. How can it be diagnosed? Yours truly, physical examination by a medical practitioner can diagnose it for you. In some cases you need to do a blood test, right? In some cases you need to do a stool test, and in some cases you need to do it endoscopically, right? That's how it can actually be diagnosed for you. So having said all this, I hope you learned something to do. So what are you going to do better? Lifestyle changes helps to deal with the issue of gastritis. For example, if you're someone that drinks alcohol, learning to reduce your alcohol intake and even cutting it out completely will be a good thing for you to try. And then just avoiding spicy food, because the more you eat spicy food, and imagine you're having an inflammation and you take spicy food, they will then increase the erosion, increase the pain that you're already having. And taking citrus fruits too, that fruits that are rich in hydrochloric acid, can again aggravate the symptoms. Again, that's not what caused it, but they can increase the symptoms. So just making those adjustments with your diet, eating food that are rich in minerals will help you. Eating food that are less acidic will help you, right? You know yourself better, so just learning to do those things that can promote your health will go a long way to help you with the symptoms. All right, guys, I hope you learned something from today's episode of Wholesome Health. I just really want to be there for you. I really want to support you with your health. In this journey of life, we must make sure that every aspect is covered, right? Remember, I'm your Wholesome Health coach, and I coach you on how to live healthy spiritually, physically, mentally, and socially. So get ready for my next video because it's going to be fire. We're definitely going to talk about social health series, if you know what I mean. So I'm already warming up for my next video. But please do also like this one, subscribe to my channel.